Before we begin, I would like to cover important points that we covered before we dive into this webinar. Firstly, it is mainly for educational purposes, and we're not giving any personalized or professional medical advice here. This is also just based on expert opinion, and we are covering only type 2 diabetes. And this all this educational advice is not meant for type 1 or other rare type of diabetes. And also, like before you're making any changes to your diabetes management, please do consult a doctor before you do that. The main objective of this webinar, or I would like to make it more of an interactive conversation, is what are the foods that have the highest impact on glucose level? How do we choose the correct snack? And what does an HbA1c tell us? And is that an enough of a marker to tell us an overall glucose viewpoint? Before I go deep into it, I would want to bring this point, highlight this point, that there are a lot of feelings of shame and guilt and feeling judged by a lot of people. And there's a lot of negative self-talk and emotional distress that people go through when they're newly diagnosed with type 2 diabetes, or even for years of type 2 diabetes if they've had. And we want to focus on freedom around food. We want to break free from this diet prison, and we want to embrace mindful eating and enjoy food without having any guilt or any kind of restrictions. So with that in mind, this webinar is not meant to judge anybody or say that this is a good food or this is a bad food, but mainly from the perspective of how each food impacts different foods impact our glucose level. There are about 42 variables that affect glucose control. And a lot of times we're just looking at the diet aspect of it and the meal aspect of it. And it's majorly the carbohydrates that we talk about, or the glycemic index, or the fat and protein. But there is much more to glucose control when we're talking. It's also the insulin sensitivity, and which is dependent on our muscle mass, how active we are during the day, what kind of stress that we're dealing with day in, day out, and how deep we're sleeping, how is our sleep duration, what is our circadian rhythm. All those will affect our glucose control. Then there are other factors that play a role. These are called incretin factors. So basically, how soon is the food traveling through the gut? That's called gastric emptying. That's also going to affect how soon the glucose will spike. Is the food actually getting absorbed or not? That's one aspect. And then there are a lot of people who are on insulin. How did they time their insulin? What other medications they're on? What types of insulin they're on? All those affect the glucose control. So yeah, there are different foods that are impacting the blood glucose level or the release of insulin in our body differently. When we talk about simple carbs, mashed potato, the way it is prepared, so it's a very quickly absorbing type of carb. Then breads, even rice, so they do spike the glucose very quickly. Whereas the protein and fiber, it does not have much of an impact on the glucose level. The way nutrients, macronutrients act on blood glucose over time is based on what kind of meal has what kind of macronutrient in it. So if majorly it is simple carbs, the glucose is going to spike significantly, versus protein and fat take about 3 to 4 hours to show up as glucose in the blood, and usually the spike is not that much. Also, it depends on the type of carbohydrates. So if you're having a high glycemic index food, it's going to rise very quickly within 15 to 30 minutes, versus a medium glycemic index food will rise it slowly over a period of 1 hour, and low glycemic index food 60 to 90 minutes, and then it usually does not cause a significant amount of spike. So your high glycemic foods would be your juices, your mashed potatoes, again, breads, The medium ones would be rolled oats. Low glycemic index food is legumes and beans. And there are very simple ways to improve glycemic index of a meal. And it's very easy. If we just combine protein and fiber with carbohydrates, you're going to have a blunt in the glycemic index food, and the spike is not that rapid. Also, if we follow a meal order in sequence, so of course, we want to combine protein and fiber with the carbohydrates, but also start your meal with the fiber. So, eat your vegetables first. It'll create a mesh around the stomach lining and not let the glucose absorb very quickly. And if we add protein to that, what it does, it slows down the gastric emptying time, and the carbohydrates again are not absorbed very rapidly. Also, if we swap processed foods with whole grains, again, because it's not that polished, it will not rise the glucose very quickly. So white bread, again, it's highly processed, and I'm glad everybody knows that this is a no-brainer. White bread will spike the glucose very quickly. It's almost equivalent to eating sugar or eating mashed potatoes. But then Ezekiel bread out of all these, which is, not an exact form of bread, but it is made of sprouted, it's a sprouted bread made from whole grains and legumes, and it does not cause that rapid of a glucose spike. Also, if we eat sourdough bread, which is properly made and fermented, and it is all, if it is, we use the 100% whole wheat one, that also has shown at times to reduce the glucose spikes. I mean, I think that's a very important point that is brought. So taking in small amounts, again, that meal order and sequence definitely helps. When you're eating the fiber first, the protein later, or combined with fat, the and a small amount of white rice, it will not spike the glucose as much. But also, like the type of rice will decide how fast the glucose spikes. So there are different starches, so amylose and amylopectin. The higher the ratio of the amylose and amylopectin in a particular rice, the lower the glycemic index. So white rice, which has low amylose, will have a glycemic index of 17. So long grain basmati rice, again, that has a very low glycemic index. Brown rice or parboiled low amylose rice will have a lower glycemic index. What is better for my diabetes control? We do talk about, a lot of people have this idea about, I'm not going to take any sugars, but I can take artificial sweeteners. And then there is talks about, let me take honey instead. So what do you think that, which one is better, honey, sugar, artificial sweeteners, or none of the above?
I've heard of something called coconut sugar, Dr. Sumeet. I think it's kind of trending now. People started talking about monk fruit sweeteners and coconut sugars these days.
Yeah, I'm glad you're bringing those, controversial things up so we can talk more about it. So the idea here is to understand that when we're talking about simple sugars, they absorb very rapidly. So they are just two molecules of glucose, and then they break down. So be it honey, be it jaggery, be it, corn syrup, or of course, even fruits, even milk, because they have simple sugars and they break down very quickly, they're going to rapidly absorb the glucose level. Uh, so, out of those options, honey sugar is definitely not a good idea. Now, artificial sweeteners, a lot of people use and have been using, especially when we're talking about zero calorie or zero carb sweeteners. They could be an option, but what happens is, what recently we have found in a lot of research these days is that it's altering the gut bacteria. It also has 1,000 times much more of a sweet taste than even sugar. So it's not letting you come off of your sugar addiction as well. So in any case, we are trying to avoid artificial sweeteners, but once in a while, it's okay to go ahead and take it. Coming back to coconut sugar, yes, uh, although it has been shown to have a little lower glycemic index, so people are favoring it, we still have to have a little longer term studies about it. And same goes for monk sugar and even date sugar. Date powder recently has been shown to have a much lower glycemic index. So if you're making a dessert at home, you can use date powder to do so. What about cookies? It gets very challenging for a lot of people who are used to eating cookies, especially with their coffee or their tea, and it gets difficult to decide which one to buy from the market. So, do we go ahead and buy cream cookies like Oreos or the regular cookies? Is it sugar-free cookies that one should opt for, or what about oatmeal cookies?
I think it must be sugar-free cookies.
So, Apurva, you bring up a very important point, and this is what we want to look at. So, always look at the nutrition facts. So, when we're talking about, say, for example, we talked about bread, we talked about mashed potatoes. So, the total carbohydrates were similar, and then the spike, because they were so highly processed, they lead to a lot of spike. So even when the sugar is 0 gram for the figure in the right, the total carbohydrates is almost similar to the one that has sugar in it, added sugar in it. So in fact, the amount of rise of the glucose is actually similar, or it may be higher sometimes in sugar-free cookies. And that myth that, oh, we're eating a sugar-free cookie, is just, we're just falsely satisfying ourselves, but it is ending up leading to a higher glucose spike for us. And even talking about oatmeal raisin cookies, we talk about oats as a medium glycemic index food. So maybe it won't cause that much of a spike. So again, we don't need to go back to the nutrition label. We need to look at the total sugars, added sugars, and the total carbohydrates. So as you can see, the added sugars is much higher than the other cookies, and total carbohydrates is also slightly on the higher side. So it's very important to start looking at the nutrition label before you buy it. It's always better to make a home, do a home baking and then make the cookies at home, or buy those cookies that have much more nuts in it, because nuts have healthy fats and they tend to reduce the glucose spike. But we do have to be careful about amount of butter that's added in it, or if there are any trans fats, again, those would be an unhealthy option. So the quick learning points here are: glycemic index of meals can be lowered by following certain steps that we talked about, like meal order and sequence. Then complex carbohydrates should be preferred over simple carbohydrates, and always look at the nutrition labels. And because we saw that sugar-free cookies contain more carbs in general.
Dr. Before we move to the next things, I think we have two questions. One is from my side and one is from Mr. Jagdeep. So let me just take his question first.
Yes.
His question is, first thing in the morning, what can we have with tea?
Okay, that's a very good question, and it becomes very difficult because most of us, culturally speaking, are used to eating a cookie or a biscuit. So if we can start training our mind to eat makhanas or eat something savory but salty with the tea, then it will help with the glucose spike. But if you're still wanting to eat a cookie, again, choosing a cookie which has a lot of nuts, maybe almond flour is used and date powder is used to prepare those cookies, it'll really help.
And from Mr. Jagdeep, he asks if namkeen matri is okay to have in the morning.
Again, so that namkeen matri is actually made from all-purpose flour. So maida. Again, that again will lead to a spike. So rather you can have a leftover roti, make a roll out of it if that's something you prefer, or maybe peanuts, or again fox nuts, foxtail nuts. Those could be better options than the matri. Or some namkis that are made out of gram flour or besan, those could be options. Again, we we can, whenever we are eating our foods, again, we do talk about portion control, but then the idea of going back to, we want to do this mindful eating. So whenever we're eating, keep it in a bowl and eat slowly. So again, we want to train our mind to see that do we really need this food, and is it just the mind that is asking us because we're craving for it because we've been doing it for so very long time.
Great. Doctor, since you spoke about label reading, so one of the, I mean, most of the food items that are being publicized today are talking about, GMO free, right? So these are, they claim it they're genetically not modified. So what is the importance of GMO in our food?
Yeah, so when we talk about GMO, basically the reason why they were created was to probably improve the taste of it, probably improve the texture of it, so that the liking of it is improved and people would buy it more and more. So I think we need to go back to basics and go back to the natural way of eating food, however it's grown, because we've realized it can have long standing effects and harmful effects in the body. So it is very important that we do look at that aspect also. Now there are a lot of hybrid variants of a lot of vegetables that are available. So again, it is very difficult to look at which ones are non-hybrid vegetables also. But then again, it is best whatever is locally grown, seasonally grown, and naturally grown. I think those are some things we need to look at when we're eating them.
Got it, doctor. So oats, for example, is a genetically modified food, right? So what's the effect of oats on our blood glucose levels? Is it even suggestible for someone with diabetes?
Yeah, so that's a very good point, Apurva. So when we talk about instant oats, people always look for something that's on the go. So when we talk about instant oats, they are uh, flavored. They do have high sugar content, and then they are going to spike the glucose level significantly. Now, when we want to switch it, we want to prepare an oat meal. Then it is better to use steel cut oats because the rice is not going to be as significant, and the more nuts we use along with those, then again the glucose spike is drastically reduced. Now, I'm talking about people who have type 2 diabetes, they will see that glucose spike. People who do not have type 2 diabetes, their body's reaction would be in terms of an insulin level that's going up, ultimately leading them to develop either pre-diabetes or it's a stage before they're already in that stage of developing pre-diabetes or type 2 diabetes. So the insulin spikes are significant, basically.
Got it, doctor. Thank you so much. Over to you.
Yeah. So we'll switch gears. Now we're going to have a separate type of discussion on blood glucose and its monitoring. So a question would be, how often should I check my blood glucose if I have type 2 diabetes? I should check fasting and post meal glucose levels twice a month, twice a week, every single day, multiple times in a day, or depends on my medications.
Ideally, before what they consume, because that will help them plan on what to eat.
Okay. Anybody else would answer that?
Mr. Jagdeep says depends on their medication.
All right. Very good point. Yeah, so I would want to bring your attention to this one of the uh, patients that I've seen. She's a 30-year-old female who has type 2 diabetes, and she's been checking 2 to 3 times per day. And her readings have been, fasting was 82 and post dinner was 128 to 165. She felt really happy about the readings. Would anyone want to mention or say something about these readings?
Yes, these are random numbers, right?
Yeah. Yeah. So these are random numbers, and these are only 2 times a day. And when an HbA1c was done, it showed that it was 9.1%. Looking at that, she was quite shocked because she was in this happy mode that, her glucose levels are significantly better and she's doing completely fine. Because of the HbA1c, a continuous glucose monitoring sensor was placed. Now, if people don't know, most people know about this. It's a device that we can place it on our arm, and we can check glucose levels without the need of pricking, or very minimal pricking is needed as such. This is what showed on her glucose monitoring sensor. So you can see 50% of the times her glucose readings were higher than 180 and reaching almost 250 to 300, sometimes even 400. So just checking 2 to 3 times is not enough. She's been checking somewhere here, 82, as you can see, and then there is another reading of 80, 165. So it's a very false picture that sometimes we get when we're checking only 2 times a day. And we talked about, when, how often should we check. So it again depends on the stage of diabetes that you have. It also depends on the medication. But once we have an HbA1c, which is much more, like above 7.5 or 8, then it's advisable to check at least 4 times a day and have a continuous glucose monitoring sensor placed if possible. Now, which statement is true about HbA1c? It tells us about glucose average over a period of 3 months. It is a complete reflection of what's happening to our glucose levels in our body. None of the above or both the statements are true.
Quite a tricky one. Mr. Jagdeep says it's both 3 and 4.
Okay, 1 and 2.
Yeah, I assume so.
Okay. So these are the many faces of a 7% HbA1c. If we let's talk about what is an HbA1c first. Uh, HbA1c is glycated hemoglobin. So glucose molecules, when they bind to the hemoglobin level, then we get an average of the glucose readings over a period of 3 months. And that's because the lifespan of the RBCs, the red blood cells, is about 3 to 4 months. So that's what we're looking at, the average of a glucose that has been there for the last 3 months. Now, if we have a very low glucose, like say, for example, 20% of the time, 40% is high and 40% is in range, we'll still get an average of 7%. Or if we have a good 70% in range, 25% are high and 5% are low, we're still getting a 7% HbA1c. Or if we are having 80-90% in range, then also we might get a 7% HbA1c. Also, because it is dependent on the hemoglobin level, if there is anemia, if there is iron deficiency, blood disorders, chronic kidney disease, all these will have an impact on the HbA1c and will not get a true picture of what the true average has been over the last 3 months. So we need to have a better peak. So this HbA1c is just a snapshot in time, that also retrospective. We need to have much more of a real time observation of what is going on, and we need to have a complete movie of what is needed in terms of the glucose levels, what's going on in the body. So if our HbA1c is more than 7.5 to 8%, like I mentioned, or we're on multiple medication, there are benefits of checking 3 to 4 times per day, or even having a continuous glucose monitoring sensor. What that does is, if we are in early stages, we're able to reduce the insulin quite rapidly, or sometimes it can actually discontinue. Or if we're on multiple medications, we can avoid the risk of hypoglycemia, and also we can avoid the risk of worsening of glucose levels. And often we're able to bring our glucose levels to a good time and range, which means Our blood sugars can be between 70 to 180 more than 70% of the time, which is now the recommended way to look at how we're looking at glucose levels rather than HbA1c. So what we're doing when we're using continuous glucose monitoring sensors, it's a behavioral strategy more so, apart from what a medical perspective, even for the person who has type 2 diabetes and pre-diabetes. It gives us an instant feedback, like, this is what I did, I ate, and this is how my glucose spiked. I exercised, it went down or up depending on the type of exercise. I'm quite stressed and it's constantly going up. So there are people who are using continuous glucose monitoring sensor for those who have type 2 diabetes. It has been shown that they're able to respond to these fluctuations 60% faster than traditional monitoring. And we're able to take care of these severe episodes and reduce these severe episodes by 75% of the time because of the timely alerts of high and low glucose levels. So let's look at this example. When this is again a graph of the glucose reading, it's cut off because they were not near the sensor. The phone was not near the sensor. So you can see most of the glucose readings are in 300s, 400s. So this is a person who likes to eat outside very frequently, and this seemingly harmless Chipotle rice bowl is causing the glucose levels to go haywire. And most of the day, 57% of the time, the glucose levels are much more high, more than 250. So what is usually advised now, once you've seen this glucose reading, we can advise like eating outside, what do we do? Smart ordering strategies we need to follow. So firstly, it is better to actually have home cooked food rather than restaurant portions, because restaurant portions are two and a half times larger than the home cooked food, and thus it leads to 20 to 30% higher glucose levels. Also, when we're eating from outside, we don't know what kind of surprises are there in the food. There might be some salad dressing that we're unaware of that has a lot of sugar in it. Again, if we're uh, able to choose the restaurant also, that the foods that they're able to serve are much more healthier, that again will reduce the spike almost by 50% is what has been shown. And we need to learn smart ordering strategies. We can request that let's place the dressing on the side. I will order double vegetables. I can order my protein dish first and then eat my non-starchy vegetables, and then ultimately eat, whatever I like in terms of pizza, burger, or whatever other option is there, but in a smaller portion, because I ate my vegetable first, my protein first, it may not give that much of a spike. Now, this again is another continuous glucose monitoring, and we see a day-to-day variation in this. So one day is not the same as the next day. If the person hasn't slept well, again, the glucose will be spiking to above 200, as you can see in this figure. Or during a last minute project submission, again, it has shot up to a 250s or a 280s. So sleep, stress, and many other variables are playing a role in day-to-day variation of the glucose. And often we're not aware because we've not checked it. So it's very important that either we check more often to understand what's going on, or if we have that availability and possibility of using a sensor, we take that to our advantage. So what is the recipe for good diabetes control? Nutrition, yes, that plays a very big role. But at the same time, we want stress and sleep to be taken care of. Activity comes, it is one of, physical activity is one of the biggest um, insulin sensitivity like improvement that you can see with physical activity. Of course, autonomy and self-regulation with monitoring of blood glucose, and a team of experts, a physician, a nutritionist, a behavioral health specialist, and of course, you. Like whoever has type 2 diabetes, if they stand up for themselves, they're able to take action on it. Yes, it's going to be under better control. And the heart of complete well-being is where we want it to be lasting long. We want this to be sustainable. So intuitive eating and mindful eating really starts to complete this package of a good recipe of diabetes control. And I would like to end by saying that our window of opportunity is before we've reached a stage of type 2 diabetes, which is before about 2, 5, or 10 years before that, when we have a higher BMI, body mass index, or we're in that stage of pre-diabetes where we have that capability of risk reduction. Because once we've had that onset over the next few years, which could be anywhere from 2 years to 12 years or 10 years, we'll start to have a declining insulin reserve. And once that insulin reserve goes tremendously down, nothing will be able to reverse the type 2 diabetes. So we need to take that window of opportunity into consideration and act now.
Then, would you like to share any of anecdotes from our patients, from our members? Sorry, I corrected.
Yeah, I think we have a variety, I mean, a lot of people from different backgrounds, I would say. And when we talk about all these people, I think everybody has their own challenges that they're facing. So, like I said, some people do have cravings that they need to work on, and some people know that these are their cravings and they're able to work on those, but uh, even in their home cooked foods, they're not able to figure out what to eat. Some people are limited on time and they're not able to cook much, so they end up eating outside. So I mean, there are a lot of little tricks that are needed, and ultimately a mindset that needs to be modified. So, and we're able to help them navigate through these things, and it's very satisfying to see everybody's journey. And I'm glad that we're able to help most, if not all, people in this journey.
Great, great, doctor. Okay, since we don't have any more questions, I think we can conclude this session, doctor. Thank you so much for taking your time and always sharing wonderful insights. Every time I attend your webinar, there's definitely something that I actually write down and take it back home. So thank you so much for putting in all the efforts and bringing very practical things to the plate.
Thank you for having me, Apurva, and you're very generous always in your kind words for me. Thank you.
Thank you. Thank you, everyone, for joining us today.